have this be like.
Do some straightening on my shoulder.
All right, I'm gonna have this. You know how I was pushing down on your shoulder? I'm gonna have this band be like a little bit of like a downward pull. See if that makes it any better. Can you do that with a little less pain?
Okay.
Keep these muscles tight when you lower down. So I want these muscles tight. Control it. Try not to let this shoulder bump up as it's lowering down. Does that hurt?
Yeah.
I'm gonna pull a little bit more. Does that help at all with this pressure or not really?
It's making it hurt, but...
It's making it hurt more? Well, I want it to make it hurt less. Okay, try. Any better?
Yeah.
What? Or the same?
That one seemed different.
What?
It seemed a little different than the first one.
Better or worse?
Better.
Keep these muscles tight. Slowly down. Tighten them to lift them back up.
Okay.
A little better?
Just to the weight.
Yeah, try it with the weight.
All right, then do.
Your little pink weight. Try not to let, as it's going down, don't let this shoulder bump up. So you're trying to keep this
Keep
down.
it down. Okay.
Good, and then tighten to pull it back up.
Does
Does that hurt? Pain or hard?
Pain, something.
When you go down or when you come back up?
Both right there.
So don't go down all the way. Stick in like a little bit of a pain-free range of motion. Don't kill yourself. Go down and then pull it back up. Tighten. See how high you can go up without pain. So find that pain-free range of motion and exercise in that. Now I'm going to take this away and I want to see if this is helping or not. So do it. Is that worse or about the same? Does it feel like that band helps? Or is it about the same?
Well, the band was kind of tight on it, so it was holding it down, but...
So I want you to use your muscles to avoid, as that shoulder rolls, you want to avoid this coming with it.
Yeah.
So you want to keep this stationary.
Yeah, go on it. Twist over.
Don't go down so far.
Alright.
Don't go down so far. Control it just to there. And then lift it back up. Don't let it pop up.
Come on, Bone. Work with me here. You got it. I'm tired of pain.
There you go. That's better. Does that feel better?
Yeah. I can't go down any further than this.
That's okay.
Okay. Let's go. One.
Kind of pick it up as far as you can. Lift it up, lift it up, lift it up as far as you can without pain. Great, because that's the muscles that we're working at, lifting up. And control it on the way down. Couple more. So doing these at home, not with a lot of weight, lightweight, but more really thinking about keeping that shoulder down. So I want to see without my finger there, can you keep this down? Control it. Don't let that pop up as that shoulder because you need to like separate. Sometimes when you have an injury, everything starts moving as a block. You need to kind of separate this motion where you get this isolated rotation and that shoulder doesn't follow. Do you understand that?
Okay.
Does that make sense? Sort of.
So don't make the shoulder go forward.
So you want this to rotate and not everything to come with it. Okay? Which you're doing a good job. If I have one finger there, it goes, but it's just if you're gonna practice this on your own, you've got to kind of be able, and that might mean that it can't go all the way down at first. As it gets better, you're gonna get more motion without pain. Don't let it pop up. Tighten. and have it be the muscles moving. And lift it up as much as you can. Tighten, tighten, tighten. Lift, 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 lift. Hold it there. Slowly down. Okay? So you're going to do this in different positions. You can be facing the table. Then you can turn your body a little bit to the side. So it just gets the arm in a little. But if you turn your thing to the side, elbow has to stay 90 degrees. So the rotation's going to be a little different, but you're not going to be moving at the elbow. You're going to have it be the rotation at the shoulder. So that looks good.
Okay.
That looks easier. Is that less tight there? Don't let this pop up. Pull up all the way up. As high as you can go. Pull, 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 pull. Keep going, keep going, keep going. Hold. Slowly down. Only where you can go without pain. Stop there and back up. Tighten, tighten, tighten. All the way up, all the way up, all the way up. Hold. Slowly down. And back up. Tighten, tighten, tighten here. Yeah. So you're going to spend, and then you can go all the way out. This one's hard. This is probably going to be the hardest position. You may not be able to go all the way to this. If it's pain, 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 you can't get rid of the pain, you're not going to do that because it's just going to irritate things. You're going to turn a little bit. You're going to find a position that you can do this without pain.
Okay.
Okay. So the biggest thing is you keep 90 degrees at your elbow and you're not letting that shoulder pop forward with you're keeping this down. You're lifting up as far as you can without pain. You hold it there, hold it there, hold it there, hold it there. Control it on the way down. So you want to get that lift as far as you can without pain because that's what's going to let you move back and lift that arm back and touch the back of your head, this lifting motion. So you want to go in as far as you can and get those muscles to work. Hold it there at the end. Keep it there, keep it there, keep it there. You can even use your other hand to try to push it down, but you hold against that resistance, okay? So so you're going to do that, and then you're going to do the bands at your side, okay? So that's going to be the same muscle, but a different position of your shoulder. So less compression there, but you want the towels here. You're going to roll your shoulders back, and you're going to do that rotation. Okay? So that you're going to focus on for a couple weeks. See if we can really focus and get those rotator cuff muscles built up. If that starts helping you be able to lift your arm overhead. Okay?
Right.
So that's good information for Adam too when you go see him. Okay, I've been really working for 2 weeks on this rotator cuff strength. You can show him the exercises that you're doing. And then, yes, it's helping to get my arm overhead, or no, it's not helping at all. Okay? So that's good information for him. What are you thinking about PT appointments? You want to wait to see when you can get an appointment with him and see how soon you can get an appointment with him before we cancel appointments?
Yeah, I'm going to walk over there after I'm finished and see.
Okay.
If I could get an appointment by next week because I need to call the Vio to book the ride. I need
Okay.
today's Wednesday already. They need 48 hours in advance.
Okay. And then I think with the knees, that seems like the most limiting thing, so I would like them to be doing something for their knees. So if he feels almost like it would be good to do maybe aquatic therapy for the legs, but in addition to something else, if he thinks that going to a different kind of doctor, having them look to see if anything's going on systemically in your system to cause pain on both sides and then pain in your shoulder, see if there's anything going on, but kind of tackling two things at once, where maybe you're doing aquatic therapy where you can really work to strengthen the legs without irritating it. I don't know if that's going to be the only solution, but also looking for maybe some other thing that might help.
Okay.
In addition to therapy.
What?
Yeah.
It's just painful every day.
Yeah.
Because it pains so much, I'm always just clenching my teeth. It's
right. You're just
I can't smile. It's
yeah. Yeah, it's exhausting.
You okay?
Not really.
No.
Not really. And then when you do the new step here and get the legs moving, does it feel better to walk after that or not really?
Well, a little bit.
A little bit.
back to the normal pain.
Yeah, but nothing like super different.
I've been doing a lot of walking and taking my son to camp. But it's like every day is getting worse and worse. It's like he's out there. He's like, "Mommy, hurry up!" It's like, "Okay, I can't." Hang on. You walking too slow. It's like, "Okay, I'm coming."
Yeah,
Mhm.
yeah.
It's like, it's just.
All right. Well, let's see what they say with appointments. And then we'll think about, because there's no sense in you continuing to come here if it's not helping. You know, it's like, go on. If it's not
Okay.
getting you, you know, if it's not helping significantly. But let's see. And I'll send him another note about what he thinks about aquatic therapy. Okay, so he thinks about that a little bit before you end up there.
All right.
Okay?
Okay.
Let me see. Do you want to do anything with like the machines afterwards?
What time is it?
It's 10:35.
Okay, I can do a little bit.
Oh gosh, I know. You are too young for this. Way too young for this.
Oh, Lord Jesus.
Oh,
Don't laugh now. Keep watching. Like and share and subscribe.